Okay, my name's Heidi and I'm a counsellor at the Aboriginal Health Service. I suppose I've had lots of connections at the Royal Hobart Hospital. Like I've had my children at the Royal Hobart Hospital. I go down there for clients. My recent experience has been in DEM and I have to say we've been in the corridor, so it's kind of ramped. And it's been awfully crowded and the staff down there do an amazing job. So they usually end up in DEM from this position. I appreciate being involved in the Aboriginal Health Service because we have a holistic and a wraparound service for lots of people in the community, actually. So yeah, I really appreciate we have that access. And we have really good doctors here and we have really good clinic staff and we have access to family support workers, Aboriginal health workers, nurses. It's great, really. Because Aboriginal people in this country do not access mainstream services very well. The men and the women are dying younger statistically. There are higher rates of suicide at every age group, and child removal is really high, and being removed from your family by institutions is really high, and lots of Aboriginal community members don't like going into any mainstream institution. And so we, with our service, in understanding that, sometimes have to access our community out at houses and outside services. Even coming into an institution like a medical service is big enough, so scary enough. So it's really important to access our community, to be part of the community as well, and understanding of that. For Tasmania, I am really hoping that we get our health funding sorted and the hospitals sorted, and if we're building a new one, build a new one. I'm hoping that, for my experience in DEM at the moment and what I'm listening from Ambo saying and nurses in there, we need more tiers above DEM to move people up. So even if we do some of those services off-site, like having separate cancer places or even having midwifery move off-site so we can move more patients up from DEM to stop the block there. And 10,000 on the waiting list for surgical is just horrendous. So I'm hoping that somehow that gets moved. Having all our young doctors want to leave, which is something else that's really topical at the moment, is a real worry. And we're going to lose all that new energy and new knowledge out of the state, and they actually really are saying something needs to be done. So I want somebody who's in the portfolio who really understands medicine. Perhaps we need a politician who's a doctor, I don't know, or a nurse, someone medical who really knows how to really sort the health service out in Tasmania, because we are small and unique and we should be able to get it right, really.